Thank you very much for having me in this very exciting session. In this talk, I'm going to provide an update on what Thailand has achieved during the past year in terms of the ending AIDS strategies and how these strategies have been used and adapted during the COVID-19 pandemic. And then I will point to some challenges and then we'll end by suggesting some global applications. This slide demonstrates Thailand's key achievements in terms of HIV treatment and HIV prevention over the past 25 years. For HIV treatment, the AIDS 2004 conference in Bangkok largely influenced the scale-up of ART, which was then included as part of the universal health coverage 2 years later. In 2014, the Treat All policy was announced, and then in 2017, the same day ART was launched at the Thai Red Cross Anonymous Clinic, which is the largest HIV testing center in Bangkok, and then was expanded to 10 hospitals in 5 other provinces in 2018. For HIV prevention, the Princess Somsawali PMTCT Fund was established in 1996 in order to advance the PMTCT agenda in the country towards the use of the triple PMTCT regimen, which was then adopted by the country in 2010. PrEP was included in our guidelines in 2014, and large scale-up started in 2016 through the Princess PrEP program, which uses the Key Population-Led Health Services, or KPLHS, as its service delivery model. So now let's see what achievements have been made in 2019 and 2020. But first, let me tell you a little bit more about the Key Population-Led Health Services, or KPLHS, to those of you who may not be very familiar with the term. In Thailand, we defined KPLHS as a set of services designed by key populations themselves, and therefore services are needs-based, demand-driven, and client-centered. These services are also delivered by trained and qualified lay providers who are mainly members of these key populations. In 2018, KPLHS contributed to 55% of HIV testing among key populations, and in this case, they are men who have sex with men and transgender women, as well as contributed to 55% of PrEP services delivered to these key populations. And this has led to the legalization of KPLHS in 2019 through the announcement of MOPH regulations, which allow KP-led providers to perform HIV and STI testing, as well as to dispense PrEP, PEP, ART, and STI treatment. In addition, the KP-led Princess PrEP program, shown in blue here, has contributed the largest PrEP implementation dataset to the country, which has led to the inclusion of PrEP under the universal health coverage in October 2019. However, up until now, we only have reached 9% of the total PrEP target, calculated based on the number of key populations who are at high risk of getting HIV. The expansion of same-day ART from the HIV testing center in Bangkok to large hospitals outside of Bangkok has not been easy, mainly due to the larger proportions of patients who presented to these hospitals who are in advanced stages, and as well as some hierarchical medical systems in these hospitals. However, the acceptability among Thai PLHIV for same-day ART has remained high, with 90 to 95% of both key populations and general populations accepted same-day ART once it was offered to them. So in summary, in 2019, key achievements are the inclusion of PrEP under UHC and the legalization of KP-led providers, as well as the legalization of HIV self-testing. Although up until now, we still have not yet had any HIV self-test kit in the market, since none of them has completed the registration process. And in 2020, same-day ART will be included in our guidelines. Key population-led providers will be nationally legally certified, and the domestic funding mechanism to directly support KPLHS will be further strengthened. Now with COVID-19, KPLHS has used its strengths to immediately respond to basic needs of key populations that they serve. And swing has been one of key example for the use of KPLHS to rapidly adapt their activities to allow their staff to cook hot meals in the morning, distribute them during the lunchtime, and then come back to open up the clinic to provide HIV and sexual health clinics in the afternoons and evenings. And throughout all KPLHS sites, telehealth, express services, drug delivery, and self-sampling have successfully and rapidly integrated into the clinic flows through the support with virtual training and virtual coaching. In addition, building on the recognition of KPLHS among local public health authorities, KP-led clinics have been part of provincial COVID-19 workforce, helping with the screening and referral of vulnerable populations. So I personally am very happy with the progress Thailand has made over the past year. However, I do feel that there are some challenges that we need to overcome in order to get Thailand to end AIDS sooner and also in a sustainable way. We all realize that Thailand has long been praised by international partners for their capacity to domestically finance HIV treatment. However, for HIV prevention and KPLHS, instead of quickly plan, implement, and optimize domestic financing mechanisms, the country seems to have a false sense of external funding sustainability, mainly from the Global Fund and PEPFAR, causing complacency among PRs and SRs. And this is not only among government PR, it's also among the community PR as well. The country seems to want to save money for a few more years by not having to pay for some commodities. And although KPLHS has been legalized, the country does not seem to recognize and accept that these KP-led organizations will need to have the operational costs and in-country technical assistance costs be financed domestically for sustainability. And I don't want to say that it started to look like our country and its funders are using this nurturing mechanism, but not in a way that it will make our country ending AIDS sooner. I will now want to end by saying that we already know which interventions are needed to end AIDS, but we may need to use implementation research frameworks more to guide our progress and also to enhance external validity needed for global scale-up. And the social norms needed to influence implementations of these strategies must be made at a global level as well. And funders and governments worldwide will need to be more sincere when considering true progress as well as the actual needs for external funding for a country. And finally, we all need to end it sooner since health beyond HIV is waiting for us. I'd like to acknowledge our wonderful partners, colleagues, and funders. Thank you very much.